This is the Tuesday, May 19th Opioid Settlement Fund Advisory Committee. Unfortunately, tonight we do not have a quorum, so I will not officially open the meeting in the usual way, but it is now 6:05 and the meeting will begin. The first item on the agenda, and under Mass General Law, Chapter 30A, Section 20F, this meeting is being recorded. We usually approve minutes, but because we don't have a quorum, we can't do that, but we can't still pledge allegiance, so why don't we just do that? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so the next thing on the agenda was Craig Dutra doing his update on the RFP that he has been working on. Because he is not in attendance, we cannot do that. I did have contact with Chris Vitale and spoke with him about that we're continuing to move forward with that. So that the next part, after he was going to be talking about the RFP and RFA, was to talk about the project manager discussion. So I think we can start with that. I did email, and if anybody needs a copy to look at, to underline, did I give you one, David? Is there one there? Yes. Because there were certain items on it that I thought if we are proceeding with having somebody who is just going to be a clerical position, where the person is going to do the management of the documentation that would need to be done, then, we want to look at maybe what some of the other things we would want the person to do. So if we take the time to take a look at the project manager from Dartmouth, the description, I highlighted 3 parts of that for myself. If we were just sticking with keeping it as the management, sort of the business side, without all the clinical stuff that she is responsible for in Dartmouth. The first one I said is oversee and manage all related programs, activities, and contracts funded by the opioid settlement. Does that seem like one of the descriptions we would want for a project manager?
Mm-hmm. Yeah, I would say so.
Mm-hmm. David?
I think I've made my position clear. I'm against the hiring of a project manager who does anything other than clerical work to manage the small grants that we're going to give. I don't feel that it's necessary. I think it's an extremely large expenditure of funds from a small pot of money. I think it would have to exceed more than 15% of our total amount, and I think that's unacceptable. And last, I don't know who is going to supervise this person's work. Is it you? Is it the committee? Who is going to oversee the work of the manager?
Yeah, that would be one of the things that we would talk about, that if it was us, if we were overseeing it, that person would be coming to every meeting that we have and describing what they were doing. But again, I hear you wanting just somebody clerical, and that's why I just focused on, the things that I selected. But I can also read what Val had. But Fran, do you have any thoughts about?
I mean, the clerical are the first 4 look fairly, fairly clerical. So.
Yeah, because the first one was the oversee them and manage the related programs. So whatever programs we advise the select board to do, then that person would oversee those. That wouldn't be our day-to-day or week-to-week responsibility, because we meet once a month. But
And the way this reads, it says it works under the general direction of the town administrator. I mean, that's what they've done.
that's what, yeah,
Dartmouth
that's
has
what
done.
Dartmouth has done.
Yeah, maybe
Because
we
it's
can
not a
talk about it,
clinical
but-
position. There's no clinical work that this person would be doing. I'm going to read what Val sent me. She sent me an extensive, looking at numbers, David, and what it would cost and all of that. So she said, as a framework for cost and time parameters, I think we need to look at scenarios between the minimum of administrative grant and contract management only to a maximum that includes education, coordinating, and engaging with stakeholders, et cetera. Administrative minimum, we discussed allocating, I believe, around 15% of an average of about 98,000 annual spend on administration. So that would be $14,000 for an administrative role. From that amount, we could apportion something like $9,000 for the grant manager and $4,000 for other administrative costs. This could also be apportioned differently, of course. So essentially, divide up around $10,000 by a fair hourly rate, and that is the hours for administration. For a very rough example, at $30 an hour, that would be 333 hours a year, or 27.7 hours a month. From my point of view, the core administrative work includes the following essential functions listed on the Dartmouth job description. Number 1. Number 2, without create and. Number 3. Number 4. Some to extent. Number 5. And then number 7, without the second sentence around collecting and analyzing data and providing education and resources to community members. So she's narrowed it down, she's looked at costs, not exceeding 50%. So do you want to look at what she wrote rather than have, I didn't,
Yep. I want to make another comment about that.
okay.
I think that the clerical work involved in administering small grants is very small. I think it would be a handful of hours to review the grants and a handful of hours to assist us in the deliberations. And then the administration of the post-award period for these grants is negligible, because presumably we're going to have at least twice yearly reports filed. And, collecting those reports and reading the reports and summarizing them to us, again, it's a handful of hours. I think it's well within the capability of this committee to take care of the administration of those grants ourselves. And the way I would propose to do it, this is a tangential statement, is for the people who review the grants on our committee to then be responsible for the administration, because it's really just a few hours. And
You want the people, the committee members to be responsible for the administration.
right, to give you a specific example, let's say Star applies for a $10,000 grant. So then that proposal would come to the committee and we would deliberate on that. And we would have presumably a primary reviewer and a secondary reviewer. Let's say I'm the primary reviewer and you're the secondary reviewer. So we review it, and then we bring it to the committee and we discuss it. And then the committee deliberates, and then they say, yeah, we think we should fund this. Okay, so it's funded. So someone writes a contract.
Well, no, then we have to go to the select board.
Right. I'm sorry. You're
Yeah,
right. Let me
that's-
back up. We ask, we propose to the select
Yeah.
board that they fund this proposal, and the select board funds it. So someone, Mr. Vitale writes a check, someone draws up a contract, it's signed, it's done. They get the money, and then the only string that's attached is that they have to file 2 reports every year. And as the primary reviewer, I would be responsible for staying in touch with them and reading those reports. And that's work that I'm willing to do since I signed up for the committee. That was my expectation when I signed up for the committee, that we would be taking proposals and that we would be deliberating on them, and that we would be reading the follow-up reports. And again, I think it's just a handful of hours that's involved. So that would be my counter proposal.
Okay. Any thoughts about that?
I mean, I think my question is, how much would the town do? Because the select board will make we make the recommendation, the select board goes. So that contract, the money flow is going to come either through the clerk's office or, through Chris, the town administrator. Is he willing to handle that kind of financial piece of it, at that end of it?
That's a good question.
Right? Because the more they can do, that's just one clerical piece that they could necessarily handle, right? Is how the money flows.
That doesn't flow very easily, from my experience. So,
May I ask a question about that? You would know best.
Yeah.
What's involved beyond writing the check?
I think you have to account for that money, right? And if there's multiple grants, there has to be a contract. There's a lot of legality
There's a contract.
pieces of it, right? But
Okay.
someone's got to manage that. Someone's got to write the check, and depending on how it's getting dispersed, someone needs to say what's in the budget, that kind of thing.
That's us.
Well, that's us, but it still has to connect, like, we don't have our own bank account, right? So if that's what I'm asking, is it gonna go through the town? Even my money is
Yeah.
through the town,
Right.
right? It's the town's account, and we work with them through that. So that's what I'm asking. Are they also willing to really be the fiscal agent? We can be the manager. Are they willing to be the fiscal agent for this? So, any kind of tax invoices, 1099s, whatever it is that we have to do to close out that grant, any kind of record keeping around that grant, are they going to be able to handle that? Are they willing to?
Do you hire any concessionaires?
I don't know what a concessionaire is.
Do you have any 1099 employees?
We have a lot of, they're not employees, but we have.
1099
Yes.
consultants, like
Yes,
say,
consultants.
you must
Yes.
have a consultant.
We
or
do.
two.
We have many
Okay,
consultants.
so when you hire a consultant, what's involved in that?
There's a quote, there's a contract, there's an invoice.
That's 30B though, right? That's covered by 30B.
Not necessarily, even if it's,
They're not 501c3. Do you?
Not necessarily.
Do you have any consultants who are 501c3s?
I'd have to think about that in a little bit more detail. But
Yeah.
either way, there's slips that go, right?
Right, but
There's invoices, and then the invoices, and there's a check that's paid against the invoice, and then the accounting of it. But
Right.
we have bookkeepers that do this, bookkeeping.
But if we were to have,
If
if we were to
it's not a lot.
hire,
That's why I'm saying, I agree with you, it's not a lot, so why wouldn't the town at least pick up that piece?
but
And if we don't have to worry about that piece, then we can more worry about the quality of what's going out.
say we hired a psychiatric social worker at, 80K plus 50% overhead. Let's say we spent a huge amount, they would still be unable to do the financials
Someone needs to be the fiscal agent.
because they would never be allowed to be the money person. The town would never give them the authority to write checks.
Correct.
So we'd have someone in the community that we're paying to do the good work that we'd like to see done. But we'd still not have the administrator to pay out?
It depends how it functions. Like, the school department doesn't, I mean, the town doesn't say no when we say we need this money.
Right.
We work with them and the accounting systems sync, but it is us directing them. I mean, why can't the town take care of the fiscal flow-through, be the fiscal agent? And can we
Well, so there-
get that off the table? You know, that
So
piece
the
of it.
fiscal agent, I mean, it's a good question, because right now, how the money flows is we had to ask the select board for $5,000 so I could function.
So they are managing the money.
So, right, and the person who I believe does the checks is Nicole.
Yeah.
So I think what Chris Vitale wants is someone who's going to manage not just that, and I have to question that. So I'll ask Chris about fiscal agent, because we didn't say those words, I think, when we met with him. But program manager, he doesn't want to have anything to do with managing any programs that are related to the settlement funds.
That's understood.
Yeah.
Right.
He's made that
have
very
to
clear.
Manage it, but
He doesn't want to,
can the town be the fiscal agent?
he doesn't want to devote any effort from his office to help us disperse the money. And that's the fundamental problem. Because it's really the job of the town administrator to administer the town funds, and this is a town fund.
Right, the money is in the
It
town.
is and
fund.
it isn't, because it is separate from the budget. It has nothing to do with
grant.
the budget. It is separate. This money has its own account, but it's not part of the regular budget and management.
That's understood, but most towns in Massachusetts are using some of their settlement funds to support activities that involve town employees. They're giving it to their Department of Education, they're giving it to their police, and they're giving it to their fire. So what's the difference, really? I mean, it's a different pot of money, but some of that money, I mean, as things move forward, people are going to apply, to ask for funding, whether it's small grants or large grants, and somehow someone has to write the check,
Exactly.
and someone has to be responsible, it has to be done properly. It's not covered by 30B. If the parties are 501c3s, like, say, Star applies for money, that's not 30B funding. But if you apply for money, that would be covered by 30B. Is that right?
If I apply,
If your department applies for settlement funds,
right, we don't, well, say it again, with the 30B. I mean, you can just
well,
transfer the money.
30B is the set of laws that govern
Procurement.
municipal
Procurement.
appropriations.
Yeah,
And it's complicated because it requires competitive bidding.
yeah, that wouldn't make sense, right? That's what I think you mentioned, that it can just go to the departments. We don't, right.
Okay.
Right, because we're applying for, usually I have to get 3 quotes, right? After a certain amount of money, I gotta get my 3 quotes.
yeah.
But no, that's not gonna apply if it's to me, to the school department.
yeah, okay.
Yeah, it would go directly to me.
Okay.
Well, not me, the school department.
I understood. But again, someone's going to, I mean, we're never going to be
Yeah, we're
people
gonna-
who disperse the money.
Correct.
We're never going to have that authority. And so someone that the select board designates is going to have to disperse the funds and be fiscally responsible, to make sure that person who's receiving the money is, not going to,
Yeah, the example you used, Donna, is perfect, right? You needed funds, somebody gave us funds, right? We don't have our own bank account and we don't write our own checks. It does come through the town, so I was just saying, clerically, right, once we start doing more than a little $5,000 request, will that still, it's just a question, is the town going to handle that piece of the clerical work?
They hold the money,
Right, so,
but there's a process to have the money given to the entities, dispersed to the entities. Nicole's not gonna write a check without having the proper forms and things in place. And so the person who would be doing this is going to be doing that to have it submitted for payment. But as it goes now, it's gotta come from the select board, because anything, when I wanted to get reimbursed, she asked me for she said I had to have two things. One, I had to have the select board's approval, and two, I had to have the committee's approval. So I had to get two approvals to use funds. So when I told her we had approval from the select board for use of the 5,000 that I could use for administration, she goes, but then you need the committee to approve how you administer it. So that's when you all said, Donna, go in and,
Yeah.
you know, with our grace, we trust that you're gonna do it, use it appropriately. So I didn't have to ask every time, but I had to show her the minutes.
okay, I was just asking, that's what I was asking.
So,
Where did that rule come from? Did she make that up?
no,
Is it written down
she's
somewhere?
not supposed to disperse funds without the appropriate authorization. She's
Why?
doing her job.
But why is the vote of the committee? And this committee?
Mm-hmm.
But we're not
We are in a.
advisory, we're purely advisory.
But we are appointed by the select board. Therefore, we are expected to have open meeting laws like we're having now.
Understood.
And that we have to follow all the public process. So thank you, Bob, for sharing that. And Nicole is doing her job. You know, she doesn't want me to be asking for money without having it clear what that money is going to. That's why I have to present receipts to her and so forth. But
But can
But
I
it-
ask a question?
Yeah.
Is there any statutory limitation on what the select board can do with the opioid
No.
settlement funds? Right, so our function is purely advisory.
correct.
So I mean, we could say no. We could vote no unanimously, and the select board could still spend the money
Sure.
legally, right?
Sure, but they've created and authorized or appointed this committee to help them, because we're doing
To advise.
the legwork.
Yeah.
No, I.
We're getting the information, we're trying to make a decision on how we best would like these funds spent. We really haven't had a clear vote for how we are gonna proceed to spend the money. We're trying to figure out what's the best use of the funds, right? When we figure that out, then we need to go to the select board and say, this is what we want you to do with it. But Chris Vitale is saying, these funds need to go in for support services and manage the programs or the applications, that he's not gonna be reviewing them, that he is not gonna have,
Right,
right? So that's why he wants someone hired to handle all of that, because that's not gonna be what he's gonna be doing.
or,
And-
yeah, sorry, almost agreeing with David, or is that the purpose, of the board? Do we vote as a board, like we're saying, yes, we're gonna do the fund there and do exactly what you did to get those $3,000? We're not asking him to make the decisions about the money.
Right, but and we met with him, the two of us met with him. He wants somebody to manage whatever that comes in that has to do with the opioid settlement funds.
We understand that.
Yeah.
But I think that that's his job, frankly. I think that's the job of the town administrator, to figure out what additional bandwidth he needs
But I
to
think
help
what,
this committee, and then request it from the town and get it, because I think it's just going to amount to a few hours of clerical support. And I think that would be the best thing. And I think, since I'm riffing on this, I think that we should go to the select board and ask them to have a conversation with Mr. Vitale about how to obtain the additional bandwidth so that we can move forward and solicit applications for the use of this money.
so I have asked to, it won't be the next meeting, it's probably not going to be until July, to meet with the select board, so I can get them up to speed on what's been happening. And Craig is on the select board, so he has Chris's ear more than anyone on this committee. So hopefully I can ask him, I will ask Craig to have another conversation with Chris about this, and for him to bring it up to the select board. We're stuck, and this is why we're stuck. And our advice to the select board is that they make a decision about how to proceed so that we can move forward, because we're stuck.
We're at an impasse
Yeah.
in, and going on 18 months. Other towns that even, the example that I always bring up is the town of Harvard, Mass., which has $620,000, even though it's a much smaller town. But they have an application that people can fill out online. It looks like an RFP, but it's just, you could go to their website and see it. I think I've brought this up at various meetings over the last year and a half. And it's very straightforward, and they have a committee, and they can advise their town manager and their board to disperse money. But they've gone the next step, and I don't understand why. We're in the same state, so all the laws are the same, and I don't see why we can't move forward and get people, make it possible for qualified parties to apply for these funds, so that we can review the proposals and make recommendations to the select board. Because the longer we go, the more resentment that's developing within the community that I've encountered in, social situations.
You're getting, what kind of feedback are you getting?
There is resentment in the community that the funds are not being spent.
Okay.
I
I
don't,
would encourage anybody who has feelings about that to come and meet with the committee.
Sure.
So we can address that, and then we can present that to the select board as well. But again, we have to, if we're advising someone, then we have to have consensus about what advice we're giving. And I don't feel that that is necessarily happening. And I think that, I hear you, David, on your concerns about how much we spend. I'm not as concerned about spending a little bit more to have somebody do a little bit more. So, and I'm coming from a different place than you are. Part of, every town has different resources, so that some may have a larger population or a smaller population. But I just look at the difference between, and I know their tax base is different, Dartmouth and Westport. Dartmouth has a youth advocate, full-time. They have a substance use coordinator who is paid through the settlement funds. They have a communications director. They have resources that we don't have. We don't have the number of people that can carry the weight of what the town is having to manage.
Their high school has a robotics team.
Right,
I mean, it's a completely different
right. So what I'm saying is that,
socioeconomic.
right, we know
Distribution.
that our budget is, and our resources in town are very tight and almost lacking because of how we're funded. And so when Chris Vitale says he needs someone to manage this, I'm hearing him because it is part of what is happening in our system, in our municipality, the demands, the needs, and the work. So I'm not reactive to Chris saying he needs help with this. I'm not reactive to that. I hear that. But he wanted us to say how many hours we need, what specifically are we looking for, and then he would proceed with that. And a conversation I had with him today was, or not conversation, an email today was, he asked me, does he want me to proceed and ask Dartmouth if they would do that piece? And I asked him to hold off because we had a meeting tonight. And also we have this event with Dartmouth on the 6th, and I don't want anything to happen between now and then that is going to have an impact on that. So I asked him to hold off on that.
Someone has to break the log jam, and I don't think that we have the leverage to do that. Someone has to pound the square peg into the round hole and make it work so that we can disperse the money into the community.
I have a question, Donna, with Dartmouth. So they've used it for the substance use program coordinator. Are they also doing what we wanted to do, which is like sending out applications or RFPs?
They've done some, they've given some to the school. They made a
Right.
decision to.
But are they accepting, yeah, sorry, go
I
ahead.
could ask Rachel, I don't know what, if anything, their applications, because she is providing the
Right.
education, the outreach, she's the one who is involved with all the stakeholders. She's there in a crisis capacity, so
Is it a full-time position?
it's a full-time position. She's there in a crisis, so that if somebody needs something, she's there and available to help.
So I just have a question. I know I joined it later, right? I joined the committee later. Was that ever discussed as, basically having one of these full-time for Westport so she can coordinate resources and versus, because I know there's limited money, and having this person going out to seek grants versus, accepting all these applications? I mean, which is a bigger load to determine, what's valid, how do we monitor the implementation? Did you have that before I got on the committee, that discussion?
We've
don't
had
know.
some discussion about that.
From the beginning, yes.
Yeah.
Yeah,
And and I have been very clear, that's what I want. But it's the committee talking about it and deciding what is in the best interest of the town. David is really strongly advocating for us to put up RFPs and RFAs to get outside agencies, and also Mosaic supported that is a good way to go. So that was in support of
Okay.
what David was suggesting. But I had in my mind an idea of creating something that was very different in town, that there would be a face, there would be a person for people to go to.
Can I ask
So-
about Rachel?
Yeah,
First of all, what is the amount that Dartmouth was given by the state, do you know,
well,
approximately?
they get twice as much as we do.
Okay, so they get twice as much?
Yeah.
So is Rachel a full-time?
full-time.
Is she paid entirely out of the opioid settlement?
No, 10% is coming from the town,
Okay, so she's 90, so,
90%. And then what's going to happen
And
is
she's an
eventually
MS
it's going to be decreased so that the town is going to assume more for her.
and she's an MSW, she's a professional?
Yes.
Okay,
yeah.
so she must be getting, her salary line must be 120
No,
What
it's
is-
less than that.
with benefits?
I don't know if she's a social worker or she's a mental health counselor.
Okay, well,
But,
she's
yeah.
credentialed. in
Yes,
some-
she is,
in
she
some-
is.
So-
If you look at the,
But,
what is on here?
yeah, you're
a
saying.
salary line's got to be 100K minimum, right? So let's say we decided to get a Rachel. so you'd have a Rachel sitting there and, what's going on in Westport. But that's a third of our money.
You don't have to hire somebody full-time. We could do a part-time position. I'm not advocating for a full-time position. The only way I was advocating for for me, a full-time position is if that position met the needs of multiple agencies, the school department, the town, police, so that that person was a face in Westport with all the stakeholders, and that person's role would be community, but it would be working with the school department and with police, when they might have, now, we're going to have Michelle talk in a little bit, but that was my vision, but not necessarily full-time. Now, I also want to say something about the money. We're getting more money. So, Nicole told me, she said, we've already gotten $60-something thousand this year. She goes, we're getting another 30 because there was another settlement. It's probably the Sackler money starting to come in. And it's not one time, because the Sackler money is going to be on a regular
10
basis
years.
until, yeah. So there's even more money coming to us. She said we're close to 400,000 now, right? So I think that's something to consider. But that's I love the idea of having agencies providing more or coming into Westport and providing something and doing the RFPs. But I also feel like there's still something missing, and Pam had said that. There was still something missing about who do people go to? Who's the go-to person in town? Is it always going to be another agency? And, and that's one of the things that, for me, I feel really strongly about having a face somebody can go to, or leave an email, have an email the person can get back to them in email, or they can, provide the resources. But I understand what you're saying, David, really I do. And I think there's a way to do both. But for example, today I got an email from Stepping Stone. I got an email, Rachel sent me, connected me with someone from Stepping Stone who's looking to connect with somebody in Westport to look at how they can help in Westport. So I suggested that they come to our next meeting and talk to us. But I'm doing a lot of work. And I think that part of my frustration is I'm doing a lot of work. And I don't want to continue to keep doing this much work. As a committee chair, I'm to bring you together and we're supposed to problem solve and do this, but I'm doing a lot.
Let me comment on that.
Okay.
If, say, a year ago, we had taken some applications from the community, from some of the 501c3s that are around here, who want to help people with OUD, some of them would be functioning now. And if someone called you, I want to help, you'd say, oh, yeah, one of our grantees, I'm going to put you in touch with one of our grantees. So you would have a Rolodex of the people that you're funding. And you would have created a network. But the difference between that and what you're proposing is that what you want to do is create a central plan that you're thinking of, that's coming out of you. And what I'm proposing is that we put out a net of entrepreneurial applications for people who have ideas based on their work in the community to come and fund what they want to do.
And I agree. But we're back to the RFP and RFA, and what Chris Vitale is saying he needs, which is a project manager. And so one of the questions I need to ask him is, are we still going to be the fiscal agent, but we need to have somebody manage any information that's coming in and doing reports? That's what you're talking about, clerical.
Let me comment about that. Mr. Vitale knows the count and the amount. He knows how much money we have, and he knows what it would cost to hire someone. So he's setting us up for an impossible situation. And all that does is delay and delay
I
and
don't
delay.
feel he's setting us up for an
I think,
impossible situation.
because I think he understands the count and the amount, and he knows that it's impossible for us to hire a manager without expending an unacceptably large fraction of our total funding. So we'll end up with a coordinator, but what are they going to coordinate? You know what I'm saying? I
Right.
mean, it's great to have a coordinator, but there has to be something to coordinate.
Okay. Any other thoughts about that role as for project manager or fiscal agent or anything else that I can bring to Chris Vitale when I speak with him?
I mean, I'm going to say, I do think that there is some benefit to having a coordinator that can coordinate your work, my work, in our existing departments. Because we have our own sort of avenues for some of this stuff, right? We have some of it going on. I'm sure you have quite a bit of it going on as well. I mean, I know there's a social worker at the Council of Aging, right? But if you did have a central person that is coordinating the resources that we have and then building upon them, I see that as a safe bet to kind of expand the work that we're existing and doing, and more sustainable, because you're embedding it in sustainable entities in town that are servicing the residents of Westport. So between the three of us, just that coordination might have some far outreach, right? Versus here's some other program, like you're saying, I feel it, here's some other new program, which is great. So now you're gonna go learn about it, I'm gonna go learn about it, Fire's gonna go learn about it. And that's just a smaller program. Between the school department, the police and the fire, and let's throw the Council on Aging on there, how many residents are we touching every day in Westport? Lots of them, right? So it seems to me that's a big way to do that. And I like what Dartmouth has done. Would the town consider, because there's no town social worker, would the town consider a piece of that salary? Would they consider maybe a 10% or whatever it is to make this a sustainable issue?
That's a big ask because of the
It's a
way the
big ask.
budget is.
Yes, but it's priorities. We're doing the work, you're doing the work. I need another social emotional support person. Your program, the fire, it's costing the town one way or the other.
It is.
We have them, I have the kids, you see the parents, the calls that are, that the fire department's getting called, we have them, so it's presenting a unified front to the town and why it's actually perhaps cost beneficial, especially if this person in turn can look for other grants, right? If this is the seed money for other larger sustainable grants. There's something to be said for it.
It's a little bit like Jack and the Beanstalk, We have money to buy a cow, and we should buy the cow. We shouldn't get the coordinator to get more money. We should disperse the money that we have. That's my opinion.
But if
I don't know.
instead of buying the cow, you bought the seeds and you planted the seeds.
We were supposed to buy the cow.
I don't know. I like
Jack was supposed to buy the cow.
I know, but he got the goose with the golden
Look at
egg.
that,
Come
yeah.
on. Okay. So I think we've discussed this enough. I am going to see if I can get Chris to move. I asked him to be not on this next one because I'm not going to be ready for the next select board meeting, but to be on a meeting, but I'm going to contact him and talk with him some more about this. And so I don't think there's any obviously vote on this right now. We're not going to be able to vote, but we're going to move forward with that because there might be some other things on the agenda that we will want to vote on. And then I will decide on, or we'll pick a date for a Zoom meeting so that we can do this. But I want to move on, if it's okay. There's no further discussion on this item. to member updates and reports. And Dr. Roy, I have you on to talk about,
I think the survey, I was waiting for Val to respond. I think the last time we conversed via email, I'm supposed to be waiting for Val to take a look at it.
I thought she did. No? All right, I'll send her a
Yeah, I
message.
think so.
But you have a survey ready to go?
Yeah.
Okay.
It looks just like pretty much the one that you did, but electronically. The school board approval of the position, I have a job description for a, what did I call it? A director of social emotional support or something like that. Social emotional development, which includes wraparound services. But I do not have any funding for that position, so I will not be able to support that position for next year.
Okay.
Do you have a clinical psychologist on staff?
We have school psychologists,
Okay,
not necessarily a clinical, if anything like that, we were probably outsourcing. We have one or two school psychologists,
oh, you do?
and we have a couple of student adjustment counselors, social workers, we have a couple of them. Mhm.
They don't do substance,
Yeah,
oh, they do?
they do, we're just, the need, they do a lot of
They're
things.
swamped.
They are swamped,
Yeah,
it's
they are.
not just substance, right, there's
They need another
a lot, mental health, right, which I
Yeah.
know the grant can cover some of that.
The grant is very flexible around kids.
We have many kids that will go get hospitalized for mental health issues, are coming back, and we have to transition them back. There are, you name it. It's a microcosm of kids who need support.
Well, now that you've been in your position for a while, what kind of substance abuse patterns, just in broad strokes, are you seeing in the schools?
Vaping,
Okay, so that vaping is nicotine, right?
correct?
Not THC.
Well, yes, we see that too.
Oh, yeah?
Yeah, oh, yeah,
Oh,
yes.
okay.
We see a lot of that as well.
A couple years ago, we had, not to cut you off, we had
Yeah,
a
okay.
fatal overdose from a vape on a street up north, and there was fentanyl in it, we found out, and it was a teenager. I think it was before you got to your position, but, yeah, so there is fentanyl and, they're even sneaking methamphetamine, stuff like that into these vapes, so it is definitely an accessible route to especially become addicted and
Right.
opens the door to other substance abuse. It's crazy, the stuff that we're seeing.
So besides THC, what else are they?
I mean, substance abuse, it's largely that, and the vaping. Mental health issues that could lead to, there's a ton of that as well. There's other addiction issues, gambling.
No,
has
but
become addiction.
this
Yeah.
is OUD territory. I'm
Yes, it
just
is, but it
curious
also
about.
covers mental health, right?
Yeah, I know,
Yeah,
but
okay.
that's.
Those would be the two major.
I just wanna
I'm sure we
understand the
have some
substance abuse
drinking that
problem.
goes around, but we don't see much of that. It's mostly, it's the vaping and the marijuana that, yeah,
In the school,
in the school, because they hide it in the vape and,
yeah.
or they ingest it in a gummy or whatever. and-
Sure.
Yeah.
And just in broad strokes, how many students are in families where there's OUD?
That,
How many students are touched
that's.
directly by
there's-
OUD?
I think I had some numbers for you before, but there are plenty, many of them. We have many students who are in foster care and/or like with a grandmother, a grandparent, and that is probably 90% of the time because of a substance use issue with the parent who's lost custody or has OD'd or whatever. So there's many people's, and then there's trauma. We have kids who, even if mom has and dad are kind of on the right path, there's sort of those childhood traumas going through that kind of recovery and the pain that it's involved that we deal with. So we have a significant group of kids and families that are impacted, maybe 25 to 40 in a town this small, that the kids are struggling and for those kinds of reasons.
And don't forget, I think, Michelle, you gave us some data about kids being home when their parents overdosed, and there was a good number of them, and so there was,
Yeah, there's
what's the follow-up? where's the support for those kids? It would be in the schools.
Yeah.
So, there's, many times it's not directly the kids ingesting opioids. It's how it's impacting the family, and kids are not in a vacuum, and they're in those families. And then how do you support these kids while, I will tell you that when we had Chris Herron come and speak, there were a couple of kids that were quite impacted by his story. They were crying, they were being consoled by some of the teachers. So we don't even probably know the extent,
Right.
but I visually saw that distress in some of the students. So that when we're thinking about doing stuff in the school or with the school department, that, that's why they're so flexible with the mental health. Mental health issues can lead to substance use issues. Family dynamics and stress can lead to substance use, mental health disorders. So they're much more flexible when it comes to that. And I'm a big advocate because I deal with adults who, a lot of them were kids who never had intervention when they were kids. They struggled with a lot of stuff, and there was no support for them. And the best place for them to get support is in school. So they can continue to, and they can learn. And so anyway, there's,
So the position that was approved,
The job description was
yeah,
approved.
it's like a psychologist or an MSW?
No, it's a coordinator, very much, that the same idea of, that you have here for this project coordinator. It's a social emotional support coordinator, because, again, we're not that kind of, we don't have that kind of expertise necessarily. I'm not gonna, but we want to make sure that the kids and the families are hooked up with all the people who do this well, right? So it's a lot of outreach with the families, this idea of wraparound model, is that you're looking at the kid holistically, and maybe just some kids don't get to do after-school activities because of what's going on with mom and dad or whatever, and so maybe we know from a positive youth development perspective, that's gonna be a really good thing. So it's a sort of it coordinates, it's like a coordinator for the student and the family that takes school and the community resources, social services for sure, could be something very specific, but it could be just broader, to look at the overall social emotional health of kids and families.
Is the person who fulfills that position likely to have direct contact?
Well, yeah, oh, for
with-
sure.
With students?
And the families, that person would be I've had this position in my other districts.
Uh-huh.
I had it in New Bedford and Boston. We had, and Fall River. We've had these wraparound coordinators. It's really, it's the family piece, right? You're not just treating the child, it's not treatment per se, it's.
Counseling?
It could, we have counselors, or it could be just hooking them up with good counselors. And we want to make sure that those kids, that whatever's going on, that they're successful during the day. And if they're distracted because so much is going on, or their attendance is poor because of so much is going on, right? So it is that coordination between what's going on inside the school and outside the school. Right? But we can't do it all, so this is why we need the coordinators, right? For the folks who have the expertise to do it.
and that term wraparound is kind of what I'm looking at in terms of having a position in town, is that this is a wraparound, that this person's available to work with the school department and the police department and the community at large. And so, I kind of like that term, but it's, when I think of the services in getting, and if they're going to come into Westport and provide something in Westport, like, Starwood or Stepping Stone Wood, they're still siloed. It's still siloed. And I'm trying to get out of, not try to get out of, but I just envision that somebody is going to be the bridge to all, we've talked about bridging all the time, bridging to the silos. So there is a connection. I just see getting a contract with this agency or this agency, then how is it going to connect and who's going to bridge into the community with that? So anyway, so you've approved been approved for the position, but you'd have no funding.
I approve, the job description is approved, but I'm not putting in the budget because I don't have the funding for it.
Right.
For next year.
And your anticipation of how much this person is going to cost is what?
It's about 100 or so thousand.
Yeah.
If not more.
Right. So if we finally get when we finally get the RFP out, you would be applying for that fund.
Well, I think I was going to apply for like 50% because we were going to cost share, so I would have to make sure I have the other 50%.
Right. Okay. So, so for me, I would want to support that kind of a program, but I would also want that person to be available in town. And that would be my idea. But, okay, so you got that, so now you got to work on the funding. All right. And as far as the survey goes, I'll send Val an email and make sure she looks at it, so you can put that out before the school year's over. It's almost over.
Yeah, our budget's done already, so it's approved, it's done, like, we're done. I don't have to kind of go back to the committee, right now, it's not in the budget for next year.
Okay, but the survey you
Oh,
can
the
get out
survey, oh,
before
yes,
the
I
school
can
year.
get that, yeah.
Okay.
I was looking over some of the projects that Mosaic has funded, and it sounds like your position would be, I mean, they're only funding, 30% or less of their applications. But have you considered applying, once you get all the budget pieces together, consider applying for Mosaic funds to match what the
Remember,
opioid?
she said they only went up to, was 50,000 was the max that they had when we had our meeting.
That's half
Yeah,
of the budget.
well,
Yeah, I mean, we have funds that we look at all the time from the state. We have social emotional funds, we have safe and supportive school grants that we certainly would look to for funds. There's money that does come out from the state to
But if you
support
could-
this.
If you can spin it as a substance abuse thing in partnership
Yeah.
with the opioid settlement funds, it seems like that would be the kind, I mean,
but it's only guaranteed 1 year, right?
okay, but
Yeah, well, we don't have any, we got nothing yet, so I'm on hold. I'm on hold.
I'm with you, and so we'll figure that out. We're all on hold at this point. All right, so Detective Donovan, you're up.
All right, so last time I was here, was a few months ago. I haven't really updated any data yet, I don't think, so I just had some things to pass out. This woman that we're using, that has set up the COSUP grant, just pass those down for me. She makes these beautiful presentations for me. Her name is Pam. She's awesome. But, so
You've got the COSUP grant back.
we might be.
Oh, you
So there's a
might
little
be.
birdie, floating around that is saying that we're going to be receiving additional funding. So we did receive additional funding for the last 2 months. So now they're reassessing the funding again, so then we can hopefully pick back up in June, mid-June, I believe it'll be. So I also finally got in contact with Nikki Fontaine of the FAST team, so that offer's still on the table as well. So if we want to pursue that avenue, working with clinicians and her team, they're open arms with us as well. So the chief and I and Officer Chicka are deciding the best route for Westport. Right now, we really like what COSUP has. Their clinicians are awesome. Their data keeping is amazing. If you can see, I asked Pam if she could, I told her about the meeting I was coming to, and she put this together in like a day. She's great. But also, COSUP is providing all of our Narcan right now. But I believe that if we were to lose the COSUP, we would have to apply through the state. So that's a different conversation. But so far in 2026, we've had 4 non-fatal overdoses, 1 in January, 1 in March, 2 in April. And we've logged 5 at-risk referrals, which are general substance abuse incidents, not necessarily overdoses. So that's anything, crack cocaine use, alcohol use, an incident where we're responding and something of that nature we're witnessing, or it's contributing to the call. We can also log an at-risk referral as far as someone calling me, hey, Michelle, my son's not doing well. Do you have any resources for alcohol use, stuff like that? So I log it just to keep track of it, and so our clinicians can reach out when they're available to follow up and provide them with resources.
May I ask a question?
Yep.
So you wrote that you have 33 overdose incidents?
So this is 33 overdose incidents, at-risk referrals, or behavioral health events. So usually I don't present the behavioral health stuff to the committee because it's separate. A huge chunk of our
I like that you're doing that.
visits- Yeah, a huge chunk of our visits with the clinicians is behavioral health, but a lot of it coincides with
But
substance abuse.
So, okay, so some of the behavioral health events involve substance abuse?
Yeah.
But not necessarily overdose?
Correct.
Got it, okay.
Yep. Yep. So that was the first half. And in August 4th, we're going to be hosting National Night Out again. The committee came last year. You guys had your table with questionnaires and stuff like anonymous surveys for people to fill out, which was awesome. I think the committee got a lot of good, useful information directly from community members. So you guys are more than welcome to come. And if, the school wants to set up a table, like anyone can
Yeah.
come.
Okay.
It's a
When is
town
it
event.
again?
So it's Tuesday, August 4th, the first Tuesday in August, 5 to 8 p.m., and it's going to be at the old high school. So if you're interested in setting up a table or, something, an activity or something like that, like,
Yeah.
aside from the committee as well, like anyone is welcome to come, Board of Health, whatever. So yeah, we're looking forward to doing that. So you can reach out to me. I can send you guys the link to sign. You can just tell me and I'll put you on the list if you guys are interested. You guys have my email, so yeah, we're excited.
Yeah.
Well, I'm interested. I'm going to have to see who, and that was on my agenda item, was for volunteering for events. So we can talk about that in the next meeting to see if who else is on board. Val, the last time David was there, I was there, and Val was there.
Oh, yeah, I thought it was very useful.
Yeah.
Yeah, well, we got,
Yeah,
how many, 40?
yeah.
40 surveys done, and we still have 16 vouchers for ice cream left, because some people didn't take them. They said, no, I don't want it, you keep it. So I have 16 left, so we'll make a decision about what we want to do, if we want to do more again, and we need more survey
It's good incentive.
results. It's,
That makes,
It's great.
breaks the ice for people to come and talk about,
Yes.
was a good-
difficult stuff sometimes.
yes, yeah, we had more discussions with people because we did that.
Yeah.
And part of, I feel, our role is in how we educate people about what the committee is doing and about the funds, primary responsibilities.
It'd be really nice if we have applications that people can file. But
Well, we can talk to Craig, who is going to do the RFA, and see if we can get that done so that we can. Yeah,
a QR code, that's all
yeah,
we need.
that's it. So is there anything else you want to talk about?
No, do you guys have any questions about what we've been up to?
What have you been up to?
No, we're just like, so our clinicians, like I said, we're on a hiatus for the next couple weeks, but
What's the drug du jour these days?
we're seeing a lot of crack cocaine lately.
Really?
Yeah. Yep, a couple meth incidents, which is scary. That's making its way this way, so, yeah, meth is becoming more prevalent.
Well, there was
so.
wasn't there a large arrest of some cocaine traffickers within the last year?
Yeah, it's
There
being
was-
shipped through the mail. That's a big thing. Yeah.
Yeah.
Yep. So we're involved with different investigations with other agencies. We help them out, but yeah, crack cocaine, and yeah, unfortunately, we're starting to see meth. So
Any of the new fentanyl, higher level
Um,
opioids?
yeah, yep.
You know
I'm
what I
not,
mean?
I don't know what the name would be because
Right.
it,
Yeah,
you don't know what they took, you
Right.
know, but, yeah.
Yeah.
Yeah, we've been at
super
a,
potent
we've been at
stuff.
an overdose recently with, the Narcan did not, activate, I guess. It didn't knock the receptors off, so.
It might have dealt with whatever fentanyl was there, but not the other.
That
The
was
mix,
keeping them,
yeah.
yeah.
There's a lot of,
Metadine.
yes, there's a lot of adding of other things to the mix, which is making it even harder.
It's like a little cocktail,
Yeah.
smoking it and.
You don't know what you get and all the pill crushers, and that's why
Pills are a
educating.
big thing,
Are you
yeah.
seeing a lot of, designer pills? Because apparently I've read people are
Pressing.
Yeah, they're-
making
yeah.
pills.
Pill presses, yeah, yeah.
Yeah.
Is
Yep.
that common around here
Yeah.
as well?
Yep, fentanyl pills, yep, they'll mix anything into it.
And that's one of the things that's really scary. It's fentanyl is scary enough, but when you add other stuff and then you go to use the Narcan and the Narcan's not working and you use Narcan again and it's still not working, we don't know what else is in it.
Yeah.
So that's why educating our kids.
Yep, where they're mixing it with, you
yeah.
know, an Adderall, and it's, their
Yep.
body's going up and down, up and down.
Yep.
That's crazy cardiac stuff going on.
Your trajectory has really fallen off. I mean, the rates have really fallen
Yeah,
off.
they really have, which is good. We were surprised to see 2 in April, and it's like that nationally. We believe it's because of the Narcan availability, education, you know, people have it in their homes, they're not gonna call the police. So we think that that's a big
Yeah.
reason why.
It's interesting, too, 988, it is Mental Health Awareness Month, by the way. 988 is showing a dramatic drop in teen suicides since 988 has been established.
Oh, wow.
I just went to another seminar on how to respond after a sudden loss through either suicide or overdose or car accident, and especially focusing on kids.
Yeah.
And how do you respond to that in a community? And they talked about the 988 showing, and I saw it online as well. I was doing some research. So that one thing, changing it from a long number to a 988 number has made a huge difference in the teen population.
That's great.
Yeah. And plus, they also have the texting.
Yeah, you can text.
So that also
yeah,
is part of it, because they
call us.
text all the time, so that's also been very helpful.
Where do
And
people in Westport get their Narcan for home use primarily?
So every time I go to an overdose, I always give, like, if it's a logged incident, I am bringing
Sure.
Narcan to these people. I believe that, does the Board of Health pass it out?
yes, we have some in the Board of Health and the fire department.
Yep.
So no questions
Okay.
asked. People can come
Yep,
and get
people
it.
can come in
So
and
now
grab
you're
it.
making me think about, to remind or to tell people, I know there's one in the Town Hall Annex. There is a naloxone box now, which has fentanyl test strips, and it's across from where the defibrillator, the automatic defibrillator is, the AED. So we want to try to distribute more of those. And one of the things that I've talked about with where in the northern part of Westport can we place these things? And now that you're here, I can ask you, who is responsible, who is managing the police substation?
So it's not always manned, as you know. There's no like call box on it or anything like that. You would call the station to have an officer meet you there.
Okay. So there's no access to that particular space for the general public? It's locked?
It's locked, yeah.
And because we've had some discussions about communications in town. And how do you bring information to the northern part of Westport? If people come to the village and they're, more connected,
Yep.
but we're divided from the highways, Route 6 and 88 divide us into quarters. And so how do we get information? And I was thinking, what about the police substation? Is there a way we can put up one of those electronic marquees that gives information that rolls across and is kept there in that. And is that a place where we could put an naloxone box?
That'd be
It
interesting.
wouldn't be inside, but it would be outside.
outside,
And so it's a well-trafficked area.
Absolutely, yeah.
It's, it's Cumberland, so people are coming and going all the time.
It's there, yeah, it's a very.
Exactly,
yeah.
so why wouldn't be able to? And I thought, well, what buildings does the town have? Do you know if it's rented by the town?
Yeah, we rent it from, I think we rent it from Cumberland Farms, like whoever owns that building, we rent it, I'm
Okay.
pretty sure. I could be wrong, but I know like when we want, like we wanted to put cameras up, there's some issue where we couldn't, because Cumberland Farms had it was something like that, so I know that we do not own that, the town does not own that.
Okay.
Farm, as far as I believe, I could be wrong, but I'm almost positive. Because we have to ask permission every time we do something.
Isn't there a fire station on Route 6 up there?
No.
It's 88 and Breaks.
Well, that's the
It's very
closest
close.
one.
Yeah, and
Yeah,
it's,
very
and
close.
it's not a public
on Route
space where the substation is a very public space.
Yeah.
Sure.
So part of bringing back to the chief is saying, how can that substation be used to communicate, to talk about, even to do substance use stuff, or Narcan, a naloxone box,
Vending machine.
a vending machine?
Some of, the representative of Mosaic told me that Somerville just got funded to have a vending machine for various, what's it called?
Safe use drug paraphernalia,
Yes.
I've heard of that as well.
Well, and it was also,
All kinds of-
Olive was trying to get one of those, but the cost was too much.
Oh, yeah.
But it could be something that, Mosaic could help fund. But Route 6 would be a more well-trafficked area where I think that would be more useful. It's hygiene stuff. It's stuff that people who may be struggling with addiction. So that's a tougher situation to manage, but a naloxone, fentanyl test strips, having something there, and then having some communication about substance use, if you need help.
Like maybe like a brochure or something like that.
Well, brochure, or even, I still think,
QR code.
for the town to have some kind of way to communicate with people, like, not necessarily the ones that you park out on the street and then they give information, but they have them where you put in the windows and it scrolls. So it tells you information and it scrolls. So, I'm thinking that is a place where we could do something, even if we look at providing some support financially to do something there. But the South Coast Public Health Collaborative is spending money on those naloxone boxes.
Is there a needle exchange program in town?
No.
I'm hoping there's no.
There was, I believe, in my recollection, that was brought up to the select board, and people voted against it. So, not the select board, but the community, people, there was uproar about that.
Is there perceived need for a needle exchange program that you've heard of?
I'm not sure, I don't take the phone calls in dispatch. I've been there because they'll call me, hey, Michelle, where can they drop off needles? Because they can't put it in our box. And we usually, does the town nurse have a place to bring that?
He has needles, but
But like,
It-
I don't,
it's
I'm not
usually
sure
for
where.
diabetic
Yeah, I don't know.
patients.
Yeah,
Well, presumably Fall River has needle exchanges, right?
Yeah. But I remember historically that was not something that people wanted
Right.
to have in town.
because then
So-
it's the biohazard,
Oh, yeah.
getting rid of it, it's a
Yeah.
bigger issue than,
Yep.
that's why
And-
we didn't want it.
Yeah, like in San Francisco.
And so I'm gonna, we'll talk more about the police night out and what people want to do and how we want to manage that, but, I can speak for myself, I will be there.
Awesome.
All
I'm
right.
part of the people planning it, so just let me know.
And it would be helpful if you can let us know the update with FAST and and COSUP, like what's happening.
Mm-hmm.
Because, I don't know where the needle exchange boxes are. But I think that would be helpful if you can let us know the update with FAST and what and COSUP, like what's happening. Because, I don't know where the needle exchange boxes are. and whether or not FAST is going to have a clinician for here or how they're going to work that. It would be really helpful to know that.
Their clinicians are through Child and Family,
Yeah.
which we use all the time. They're amazing. We love them. But yeah,
Okay, good. All right, so we'll move on to the next thing on my agenda, which is the meetings attended. I've attended a couple of meetings with Dartmouth and our collaboration with this event that our committee is co-sponsoring, along with the South Coast Public Health Collaborative and Dartmouth. So I've had 2 meetings with Rachel, the substance use coordinator, and Dolores Johnson, who's a youth advocate in town. We had a vendors meeting today to meet with vendors. There's about 12 vendors that are going to be there at our event, which I'm going to talk about the event. And I also had attended the first meeting of the Bristol County Opioid Task Force. So the person who asked us to contribute to the corrections, that didn't get carried. It didn't get through and didn't get the the Mosaic money, so they couldn't do it. But he's trying to bring Bristol County together so we can pool funds to do projects and to look at what the needs are. So as a way to get more bang for our buck and maybe get some more assistance, because we don't have as much as some of the other communities, that may be a way to go. So we're not going to, I think we're going to meet every couple of months to kind of talk about what we're doing and what we might need help with, and we can email each other. But I went to that meeting. And then David and I went to a meeting with Ally, who was here from Mosaic.
It was yesterday.
That was yesterday. I had 3 Zoom meetings yesterday. So basically, how they can support us in how, told us more about their program of giving us matching grants, but they said that they had 70-something applicants and they were only able to give money to 18. And there's no guarantee of any money continuing, so it's like a one-shot deal. So if there's a program
Yeah.
that we feel strongly about and we need some support from them, we can do that.
Something I want to ask Detective Donovan. Do you have a concept of how many Westport residents are currently incarcerated for, locally, not, in Concord, incarcerated
in
for-
Dartmouth,
Yeah.
I believe I presented that number a few months ago. I can get the number for you if you give me a little bit. We can carry on. I can.
Yeah,
get it at the
he-
end.
Well, I'm
Is
just,
she-
because I wanted to revisit that.
Okay.
Because it turns out that there isn't a mandate to treat incarcerated persons with substance abuse disorder. So there was a pilot project to do that, but that pilot project expired. So my understanding of the current situation, because I was through a medical organization, I was chatting with someone who's on his town's opioid committee, and also has done a lot of addiction medicine and prison work, that there's no incarcerated persons are not entitled to get Suboxone. So they're not treated. And I was wondering if that's something that we could collaborate with other towns that feed into that correctional facility.
So I think that the
to make sure
person,
that the incarcerated people have access to OUD treatment.
I can send an email to, I can't remember his name, but I can send him an email and suggest that may be something we can all talk about and you're welcome to go to
Yeah.
the Bristol County Task Force.
Yeah, I mean, if it depends on how many.
7. In November, it was 7 people.
Oh, 7 less
Yeah.
portions.
Yeah.
Who-
Westport residents
Who would
currently
need-
incarcerated in Bristol County,
With substance abuse disorder?
yes.
So who would theoretically benefit from better treatment? You
Just
don't-
asked how many.
Okay.
We don't know what kind
Yeah,
of
I'm not
treatment
sure.
they are or
Yeah.
not
They couldn't
getting,
give
but
me
that's
all
an
the
interesting,
information. Yeah,
that's an
Yeah,
interesting
I don't know
thought.
how we would even get,
yeah.
they probably wouldn't tell us. Well, the new sheriff is a good guy, right? So he might
Yeah,
tell us.
I mean, we could ask him to come and speak to us, you probably
Yeah,
would.
I mean, 7 is, it's a decent number of people.
Yeah, it is. All right, so I'd like to move on from the meetings attended and that discussion, but the event that we are collaborating on with Dartmouth is called the Feel Good Fair. It's over there, the camera. And it is June 6th from 11 to 2. And I want to let people, anyone who's watching know that is free yoga at 11. And then there'll be vendors, mental health vendors, from 11 to 2. And from 11 to 2, there's also a free petting zoo. So this is a very family-friendly event. We'll have 2 speakers, one from High Point Treatment Center and one from Sunflowers for Sally. I also want to say that the fair is called the Feel Good Fair, but it's promoting wellness, prevention, and recovery for a healthier community. So, and there is going to be free food and drinks, but it's first come, first serve. So we have a limited amount, but we want everyone in the community in Westport to come, because it is in collaboration, again, with Dartmouth, the Public Health Collaborative, and our committee. And I also included, I think, a copy of the press release for everybody to see. And so that brings me to volunteers for the event. If anyone is willing to be at the Opioid Settlement Fund Advisory Committee table, you can let me know, because I'm going to be doing that and helping keep things in order during the event. So I probably will need some support. And I'm hoping to have another, like we did at the Police Night Out, updated information about the committee and what we're doing, and like that board, I still have that board. So, so you can let me know if you're available. Are there any other reports that we need to address? Okay, so the next thing is the committee planning. Planning is the continuation of what we've been doing. I'm going to meet with Chris Vitale to talk about how things are progressing and ask him some other questions about his role. And Fran, we're going to find out if Val has had a chance to look at the survey, so you can get that out.
Yep.
And we'll also talk about in the next meeting about who wants to be there for the police night out. Are there any other topics that we need to address? Okay. So if there's no other discussion about anything, we can end the meeting. I don't have to do a vote because we don't have a quorum. All right, thank you, everybody.
Yeah.